So I've been interviewing a bunch of people lately, trying to find a new therapist for the clinic, and I just wanted to bring up something that I've been thinking about since I had a cancellation. A lot of therapists out there, when I'm looking at their continuing education history, they're taking a lot of taping classes or ART classes. And I'm not saying technique classes are bad, but to just take technique classes is like buying a bunch of tools but never taking a class on how to use them. One of the things we look for is a therapist that has some training with some sort of manual, like on a manual certification track. And that's because one of the main things they teach you is clinical reasoning is pretty much the basis for a good practice. A good PT knows way more about when to use it than what. There are tons of, there's like rock tape and ART, like I said before, or a Graston technique or A-stim. And those are great, but they're not going to make you a good therapist. They're just going to teach you how to tape up a joint, or how to scratch somebody's skin, or how to pin a muscle down and stretch it. But they're not going to show you when you need to do it or why you're doing it. Of course, at a taping course, you're going to find people who love taping. And yes, at a manual course, you're going to find people that really love manual therapy. Fair, I understand that. But if you take a good manual course, you're more likely to find people that love manual care and really love clinical reasoning. They learn how to present a case in a concise way so that you begin to think in that same way. So I don't want to knock down taping courses and things like that, but if you're a therapist out there and you're thinking about what course to take next, don't take another taping course. Definitely don't take an ART course. Take a NIOMT class. Take a Paris class. Take some course that doesn't teach you one technique, but teaches you about how the body. There's one more thing that I'll leave you with that a mentor of mine once said, and I always repeat it every chance I get. The PT that continues their education is a PT that stands up in front of everyone, of their peers, and says, "This is what I know," but also says, "This is what I don't know."